Dr. Edwards, before we go any further in this series, we need to reset the conversation because functional medicine gets misrepresented a lot and from all sides. So let's start with the actual definition of functional medicine. Functional medicine is a systems biology approach that identifies and treats the root causes of disease by looking at the whole person. We look at genetics, environment, lifestyle, rather than just isolated symptoms for isolated systems. The goal is not symptom suppression. The goal here is to restore overall function now and long term. Functional medicine is not at all anti-conventional medicine. We love research and we love evidence. It's not anti-pharmaceutical, but it is a framework that asks a better first question: why? Why is this happening in this person at this time? And what can we do to restore the function most effectively? That's what we're going to unpack today in this episode. For the first part of the episode, we're just going to talk about systems biology, not symptoms. We're not going after symptoms to try to make them better. Not to say we don't want to make it better, but we start from a systems biology perspective. So that means we're not treating organs in isolation. You have heart disease, you have kidney disease, you have brain disease, right? The body is an interconnected system. Gut affects immune function affects mood, stress affects hormones. Hormones affect everything: sleep, breathing, psychology, heart rate. Sleep affects everything. A symptom is not a failure. What a symptom is information. Let me give you an example. In conventional approach, somebody might come in and say, hey, I can't sleep. And the doctor with 7 minutes of time is going to say, oh, that's insomnia. Here's a sleep aid, right? Take your melatonin. Functional medicine is going to ask, well, why isn't your nervous system able to just downshift into sleep? What's going on? What are your pre-sleep habits? We're going to talk about stress physiology, cortisol timing, blood sugar regulation. We're going to talk about gut inflammation. Are you taking a probiotic? We're going to talk about your trauma history. Are you having nightmares and you don't want to go to sleep? Do you have nutrient deficiency? Is your sleep environment okay? Our intervention, and for me it's always the first intervention, is sleep hygiene. Then we can talk about cognitive behavioral therapy. We can talk about nutrition changes, exercise timing, magnesium, stress regulation, and then medication. And if we start with melatonin, it's a tiny, tiny dose, or a combination of all those things. In fact, typically a combination. Functional medicine is not defined by the tool. It's defined by the reasoning, the thinking, the asking of questions, the listening to the patient. That's why functional medicine can and always does include nutrition, supplements, lifestyle changes, exercise, Chinese medicine, pharmaceuticals, physical therapy, fasting. Sometimes it's going to include medications like metformin and rapamycin that we're going to use in new ways, or NAD because we're going to treat mitochondrial failure. This is all about maybe doing less, not more, looking at your root causes. What matters is not what you use to make things better, but it's why you're using it. And that brings us to the part of functional medicine that often gets misunderstood: testing and interventions. Hey, thanks for watching so far. I want you to stay tuned for the next section of this episode. We're going to talk more about how testing and treatments are meant to be used in functional medicine, and maybe a little bit about how they're often misused. And while you're at it, waiting for the next episode, be sure to like, follow, share, comment, ask us questions for the next Q&A episode. Thanks for watching.